with you in just a second. Hi, nice to meet you. If we can start by you giving me your first and last name. Okay, and the first line of your address, please. Great. Okay, so we're going to be starting with a series of questions, and we'll be moving on to examining the face first using my hands, and then with a flashlight, and then we'll be performing a series of tests just to test your vision in numerous different areas. So are you happy now to proceed? Okay, so questions kicking off with, do you wear glasses or contact lenses? That does include any reading glasses. Okay. Have you noticed any changes in your vision in the past 12 months? Okay, are you currently experiencing any pain in or around the eyes? Have you had any trauma or facial surgeries in the past 12 months? And any medical problems whatsoever in the past 12 months? Okay, so now we're going to be going on to the general eye inspection. So we'll be using gloves for this part. They are vinyl non-powdered gloves. First check in with my hands, and then I'll get the torch out to check in more detail. If at any time you wish to stop, do let me know and we can pause. So just looking straight at me if you can, and I'm just going to be feeling around the eye sockets and just in general around the eye area, including the eyelids as well. I'll be asking you to shut your eyes in a moment, but first of all I just want to check in and around the eye area. So if you experience any pain, do let me know. Just looking for any swelling or redness. Does it hurt at all when I do that? Okay. Just along the sides here. No pain? No. Okay. Nothing, no pain there at all, no? Okay, good. And no pain when I do that. Okay, so if you can just close your eyes for me, and now open them. If you can, without moving your head, look here, 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 here. Okay, fantastic. Now I need you to shut your eyes, and I'll be just massaging the eyelid all the way around, and I want you to tell me if you are in any pain or discomfort. Okay, so just shut your eyes for me, thank you. Okay, no pain at all. Just checking for anything out of the ordinary, any cysts, anything that might be causing you any discomfort whatsoever. Okay, you may open your eyes now and relax. I've got to make a few notes here. We're testing the muscles around the eyes now, so I'll be asking you to close your eyes, and I'm going to be attempting to open your eyes using my fingers, okay? And I want you to not let me do that, so I need you to keep your eyes shut as best as you can. Okay, so keeping your eyes shut now, I'm going to try and open them, and you're not going to let me do that. I need you to do the opposite now. So I need you to keep your eyes open, and I'm going to be attempting to actually close your eyes. I will try not to poke you in the eye, I promise. So what I need you to do is for you to not let me close your eyes, so keep them open as best you can. Okay, so I'm going to be approaching your eyes very slowly. If you can keep your head nice and still for me. Okay, and don't let me close your eyes. Fantastic. Okay, so now I'm going to be using my torch here. It is a bit on the bright side, but I need it to be bright just to really see the area in very good detail. So what I will ask you to do is not to actually look into the light as best you can. I know it can be difficult to avoid the light, but I recommend actually trying to look elsewhere if you wish. Okay. Okay, so bright light coming in. I'm just going to be touching your face ever so slightly just to help me inspect all the areas in and around the eye. Just below your eye at the moment, checking out the tear ducts, looking for anything that's be unusual. So far everything looks fine. Just going to come round to the side here just to check. Side of your right eye here, again looks fine, nothing out of the ordinary. I'm just going to press on your eyebrows here and just let me know if you're in any pain whatsoever. Okay, same now on the other side, just checking on the side of your left eye. Nothing unusual here, everything looks fine. Once again I'm just going to be pressing on your eyebrows, and I need you to tell me if you experience any discomfort whatsoever. Okay, great. Okay, now I do need to look into your eyes. I know it is a little bit bright. I will ask you to just to stare forward as best you can. And we'll get this done pretty quickly. Okay, so bright light coming in. Okay, again just looking for any yellowing of the eye itself, and also having a look at the iris and pupils. Okay, now if you could look here for me. Here please. Okay, I'm just going to pull down your lower eyelid and I want you to look up for me, okay? So looking up. Okay, and now the opposite, I'll be holding up your upper eyelid and I would like you to look down for me, okay? So looking down. Okay, moving on now to your left eye. So again, just looking around at the whites of the eye, just checking for any yellowing, looking at the formation of the blood vessels, anything that's concerning or anything that strikes me as being unusual, but so far everything looks fine. Okay, if you could look over here for me, at my finger. And here please, back here again, and once more here. Okay, so once again I'll be holding down the bottom of the eyelid and I'd like you to look up. So here we go, bottom of the eyelid and looking up for me. Okay, and I'll be now holding the top eyelid and I want you to look down. And looking down, there you go, again. Okay, if you can just keep your eyes open, I'm just going to be looking at the iris and the pupils. Okay, everything looks fine. So there we go, that was the bright light over with. I won't be getting this out again, I promise you. Although there will be another light, but not quite as bright. You'll be happy to know. So far everything looks fine. Very happy with what I've seen so far. Just got to be taking a few notes here. Okay, so now we're going to be doing the follow the finger test, which you've probably seen a million times before. What we'll be asking you to do is to keep your head nice and still for me, only moving your eyes. I want you to follow the very tip of my fingers. Now starting off, we want you to cover your left eye, so if you want you can put your hand over it, or simply just wink and do it that way, whichever's more comfortable for you. Okay, so once again, following the tips of the fingers, and we're going to be moving from side to side to start with. Okay, very good. I'm going to stop there. I'm going to be moving now up and down. So again, just following the tip of my fingers. Very good. Once again. Now we're going to be doing it one more time. Okay, great. So now if you would like to cover your other eye, I'll be looking to do exactly the same again. So once again, following my fingers. Okay. Okay, doing very well. Any discomfort at all? Okay, moving up and down now. So far so good. Pupils are acting as they should. You don't seem to have any problems whatsoever following fingers. I'm very happy with that. Just going to make a few more notes here. Okay, same again now, only this time using both eyes. Once again, following the tip of the finger. There we go. Speeding up ever so slightly. Okay, that's very good. And again, up and down. Wonderful, you can relax now. So I jot down a few more notes. Everything is looking good. No concerns whatsoever so far, nor do I expect to find any. Okay, so if you just like to blink as much as you would like to now, just to rest the eyes, just give yourself a nice rest. Although it can be a little bit exhausting when you're having to keep moving your eyes without actually moving your head. It is tiring, so I do appreciate that, giving you a little break right now as I write a few more bits down. Okay, so we're going to be moving on now. A very simple test this. I want you to tell me which of my fingers are moving. I need to take my gloves off for this so I don't end up giving you an audio cue as well as a visual. So quite simply, I'm going to be putting my fingers either side of my face, like so, and I want you to look at my nose and then tell me whether I'm moving these fingers or these. You can use my left, my right, or indeed your left or your right, whichever makes more sense to you. Okay? Okay, so looking directly at my nose, here we go. Very good. Okay. Good. Well done. Okay. Okay, well done. No problems there. Very well done. Looks like there's no changes over the past 12 months, so you haven't gone backwards at all in your vision in general, so that seems very good. Very happy with what I'm seeing here so far. We will be doing just a single, one more test now and calling it a day, so we're going to be looking at, let's see, there are a few I could do now. Okay, since we covered these areas, I think it's probably best if we move on to numbers. So very similar to what we did before, except this time I need you to tell me how many fingers I'm holding up. So either 1, 2, 3 or 4. I won't be using my thumb, so I won't be trying to trick you. So once again, I need you to keep your face nice and still, looking at my nose, and then tell me, using your peripheral vision, what number I'm actually holding up. Okay, and we can start. So, just tell me how many fingers I'm holding up. Yep. Okay. Yes. Well done. Yep. Good. Great. Good. Good. Okay, just a few more. Yeah. Great, well done. Okay. Again, excellent, well done. No problems there. You've absolutely aced each of the tests, so I have no concerns whatsoever with any aspect that we've tested so far today. So I'm going to be giving you a clean bill of health. We will of course put this into the system and we'll book you in for a future test 12 months from now. So everything is fine, nothing to worry about, and we'll see you again in 12 months. So thanks a lot for coming down to see us, and we hope you have a equally successful eye test in 12 months time. Okay, well, take care, thanks a lot, goodbye.